Hello everybody, good afternoon. Am I audible and visible, guys? Am I audible and visible, everybody? Okay. So I am really sorry we couldn't have a class yesterday due to some technical issues, but now we're going to have the class continuously for 3 days. Okay, and then we don't have a class only on the 6th, guys. On 6th there'll be no class, so you can follow the roster as it is. Okay, I think tomorrow we'll be having diseases, but today we're going to look at some important points from nutrition. Now, as you know, nutrition in itself is a very big chapter, right? So how are we going to tackle nutrition? I'm going to tell you all the important things either with the help of MCQ or without the help of MCQ, which can come in your exam. Okay, so we'll be discussing the most important points from nutrition, including vitamins, guidelines, everything. Okay, so just keep looking at this slide first. This is a very important MCQ oriented slide. Okay, who is a reference man and a reference woman? Okay, who is a reference man and a reference woman? Just look at this slide. Okay, you will get MCQs, but first we're going to have a look at some of the important things. Okay, so reference man में याद रखना, age is now 19 to 39, woman also 19 to 39. Okay, these are some last minute points. And reference man का weight is 65 kg. Okay, and woman का weight कितना है? Reference woman का weight कितना है? 55 kg. Is it okay, everybody? Are you following? Give me a thumbs up if you're following. You're there. I can't see any of the messages. I don't know why, but just try to give me a thumbs up once if you can see the messages. चलो ठीक है, okay. एक second, हाँ मैं भी कर लेती हूँ ऐसे. Yes, very good, NK Shah. This BMI 18.5 to 22.9 is according to the Asian classification. Okay, but according to WHO classification, guys, what is the normal BMI? Anybody which can come in your exam? According to WHO classification, normal BMI का range कितना है? 18.5 से 24.9, right? 18.5 से 24.9. That is the normal BMI according to WHO. And we'll discuss last में indicators of obesity also. There I will tell you what are the different indicators of obesity which you need to know. As of now, don't forget age 19 to 39 year for both reference man and woman, and 65 kg is for man and 55 kg is for woman. ठीक है, got it everyone? चलो, let's move to the next question now, which can come energy guidelines. Now, how can you remember these energy guidelines? Okay, energy guidelines. Like if you are a sedentary worker, are we all sedentary worker? Yes. Even if you are studying from morning till the night, you are still sitting at one place and studying, right? So हम लोग क्या है? Sedentary worker. Even if I am teaching from morning till night, I am sitting or I am standing and teaching. There is no movement. So all of us are sedentary. Okay, so please remember this. How can you remember these energy guidelines for sedentary, moderate and heavy worker? देखो, now if you look at this 2110, okay, 2110 को just make it 2100. ठीक है, moderate को make it 2700. Now whatever is the energy which is required by a sedentary and moderate worker man, the same energy is required by whom? By a moderate and heavy worker female. So this is 2100 and this is 2700. Can you remember it that ways? Whatever energy is required by a sedentary and moderate worker man, okay, 2100 and 2700, the same energy is required by a moderate and heavy worker female. कितना हो गया? 2100 and 2700. And adult woman को 1660, you can make it 1700. Just double it, it will be 3400 here. Okay, 1700 को double कर दो. All right, and it is going to be 3400 here. Is it clear? That's how you will remember. The energy required by a sedentary and moderate worker man, 2100, 2700. The same is the energy required by a moderate and heavy worker woman, 2100 and 2700. और इधर तुम्हारा 1700 को just double it. So if you double 1700, it's going to yield how much? 3400. Got it? This is very, very important. Now what about about pregnancy, all these are no change in pregnancy and lactation from previous guidelines. All this is according to NIN, National Institute of Nutrition. ठीक है, this information is according to whom? This information is according to National Institute of Nutrition, guys. Okay, now in pregnancy, how much energy is required additional? प्लस 350. बट एक और चीज़ बताती हूँ, फर्स्ट ट्राइमेस्टर टेक्निकली नो एक्स्ट्रा कैलोरी रिक्वायर्ड. फर्स्ट ट्राइमेस्टर नो एक्स्ट्रा कैलोरी. ओके, नो एक्स्ट्रा कैलोरी इज नीडेड इन द फर्स्ट ट्राइमेस्टर. बट इफ दे आस्क यू अकॉर्डिंग टू NIN, इट इज़ प्लस 350. सेकेंड ट्राइमेस्टर प्लस 350, थर्ड ट्राइमेस्टर प्लस 450. ओके, but according to NIN, plus 350 throughout pregnancy. First 6 months of lactation plus 600. Okay, 0 to 6 months plus 600, and 7 to 12 months कितना हो गया? Plus 520. All right, is it clear? Did you understand this? Will you remember this? First 6 months कितना है lactation में required? Plus 600, and 7 to 12 months is how much? Plus 520. Give me a thumbs up if you've understood this. But अगर कोई आपसे पूछता है first trimester, do we need any additional calories? No. ठीक है? One more point. Suppose your Dadaji, who's like an elderly, like 70 years, he comes to you and he asks you that how many extra calories do I need? What are you going to tell to your Dadu? What is the amount of extra calorie would you say your Dadaji needs? If he's above 60 years, will he need the same as 2100 or 2700? Or if your Dadi comes to you, will she need the same amount? No. So how much it is? Just pay attention to this. For an elderly male, everybody, okay, for an elderly male, it is 1700 kilocalories per day. Okay, and for an elderly female, guys, कितना है? It is 1500 kilocalories per day. Okay, remember this. Elderly male के लिए the extra amount is 1700, like what they require, not the same. It is 1700 kilocalories, and for a female it is 1500 kilocalories. Then once they ask a question that which nutrient requirement, okay, which nutrient requirement, all right, is increased in pregnancy? Anybody? प्रेगनेंसी में कौन से न्यूट्रिएंट का रिक्वायरमेंट बढ़ता है? इट इज़ अ डायरेक्ट MCQ. नेम द nutrient requirement which is increased in pregnancy. And another question, name the nutrients whose requirement are increased in lactation. Nutrients, we'll just know the names right now. Nutrients requirement which is increased in lactation, and what are the nutrients whose requirement are increased in pregnancy? Very good, guys, very good. So when we talk about pregnancy, it is of course iron and folic acid. Okay, that we will see in anemia mukt Bharat right now. And for lactation, आप क्या याद रखोगे? This is very very important. Calcium is required, increased. Okay, technically calcium 1000 होता है, but during lactation it becomes 1200. Okay, calcium, vitamin A and iodine. Okay, and iodine. These are 3 golden points for the day which you should remember. ठीक है? All right, everybody, calcium, vitamin A and also iodine, their requirement is increased during lactation. And pregnancy में iron and folic acid. Okay, so these were some theoretical things that you need to remember for your exam. I hope you will remember it. Mostly they will ask you energy requirements additional during pregnancy and lactation. Now let us move to some MCQs. Okay, which is incorrect about NPU, net protein utilization? What is the correct answer here? This is a PYQ. It's an old PYQ, but still it can come. What is NPU, net protein utilization? So when we talk about net protein utilization, guys, this is used to evaluate the quality of proteins, right? This helps us measure quality of proteins. ठीक है? So which is incorrect? Incorrect पूछा है. Incorrect. No, egg actually has 96 only, which is almost equal to 100. Okay, no. I think Priyanka is the one who's got it correct, and VS is the one, and Hitesh have got it correct. It is C. Besla has got it correct. C. Please don't say NPU of 96 is wrong. No. Textbook of Park clearly says net protein utilization of egg is 96, which is like almost 100. And that is why we say that egg is a reference protein. Okay, हम लोग बोलते हैं ना egg क्या है? Egg is a reference protein. Why? Because number one, it contains all essential amino acids. Okay, and also it has maximum net protein utilization. ठीक है? It is used for estimating protein quality NPU. Yes, 1 gram protein is equivalent to 1 gram nitrogen. This is wrong. Defined as nitrogen retained by nitrogen consumed. Whatever nitrogen we are consuming, out of it how much is retained. So what is the correct answer to C? Maximum quantity of proteins is there in soya bean, but the best quality of protein is in egg. So please look at this. This is very important slide for the day. Okay, this is an important slide, guys. 1 gram of nitrogen is equivalent to not 1 gram protein but 6.25 gram proteins. Okay, 1 gram nitrogen is equivalent to 6.25 gram proteins. Okay, and then when you talk about egg, everybody, egg में क्या होता है? Rule of 6. If you remember, on an average an egg will weigh 60 gram weight. Okay, then it will give 6 gram protein. Okay, then it will give 6 gram fats. Okay, and 60 kilocalories. Ideally it is 60 to 70 kilocalories, but to remember egg याद रखना, rule of 6, 60 kilocalories. It has the maximum cholesterol. Can you see this? Also it has calcium and iron. This is an MCQ based slide. Egg बहुत पूछते हैं, so you must remember it has maximum cholesterol and it also has calcium as well as iron. ठीक है? Can I go to the next question, guys? So which is the reference protein, everybody? Egg is the reference protein. ये question exam में आता है. All right, thumbs up. Okay, let's go to another one. A basic question nowadays. Last time also Fmge mein they've asked a very basic question. What are micronutrients, macronutrients and trace elements? We will do that. पहले ये बताओ how much amount of energy. So I'm just looking at a very this thing. Okay, yes, egg में vitamin C is absent. That there is one slide, Praveen. But as we proceed, I'll tell you what is absent in some of the important nutrients. ठीक है, जैसे हम आगे जाएंगे. All right, so what is the answer to this? Very क्या लिख रहे हो तुम? B, not B, guys. 1 gram alcohol is 7 calories. Okay, 1 gram alcohol, 7 calories. Okay, so look at this slide. Carbohydrates 4 kilocalories per gram of carbohydrates. Proteins also 4. ठीक है, all right. And when you talk about fats, it is 9 kilocalories per gram. Now how much should be the proteins in your diet? If you remember, 10 to 15%, fats 15 to 30%, कार्बोहाइड्रेट्स 50 to 70% होना चाहिए हमारे डाइट में. इफ इट इज सो मच, दिस इज व्हाट इज नोन एज recommend, this is what is known as balanced diet. Okay, this is what is known as balanced diet. Okay, this is known as balanced diet. A very important question that comes. All right, next, just simple PYQs. What is the most essential fatty acid? Batao. These are some, I'm focusing on very minute questions which are turning up these days, which you can forget. What is the most essential fatty acid? You must have studied from biochem also. Linoleic, linolenic, arachidonic, eicosapentaenoic acid. क्या है everybody? Very good. I hope you all know. So let me just tell you. Linoleic is the most essential fatty acid. It is used for production of arachidonic acid. Okay. Again, we all know that essential क्या होता है? Those which are not made in a body, you have to consume in the diet, right? So most essential fatty acid is linoleic acid. All right, eicosapentaenoic acid, ये सब से भी ज़्यादा is linoleic acid. Very good. What is the source of these? That also we will discuss. You can see over here, I think Dr. XD has written, this is a very important PYQ. Linoleic acid is most essential, okay? Most essential fatty acid hai. And this is present in safflower oil. This is a PYQ. Linolenic नहीं पूछते हैं. And icosapentaenoic acid fish से मिलता है. Where do you get docosahexaenoic acid, guys? DHA कहाँ मिलता है? Docosahexaenoic acid. This is very important for myelination and everything. So that is in breast milk. ठीक है? Docosahexaenoic acid that is seen in breast milk. Very good. ये slide अच्छे से देख लो. This is, you might not get time to revise it again, or you might, it might skip from your mind. These are basic things. Most essential fatty acid is linoleic acid. The source is safflower oil. These are all good fatty acids, right? These are all unsaturated. ठीक है? All right, very good. This is very, very important. I hope you've seen this slide. Chalo. Now this is again a FMG ka PYQ. Batao. Limiting amino acid in wheat is. What do you mean by limiting amino acid? Now there is a function which is known as supplementary action of protein. वो क्या होता है? There is something known as supplementary action of protein. What is that? See, all these are basics, okay? Which food adulteration also we will study, and most of you would have studied also food adulteration, but these are things जो आप भूल जाते हो. ठीक है? So supplementary action is like, why do we eat dal and chawal together? I mean, why are we eating pulses and cereals together? Obviously it's tasty, but what is the exact reasons? Pulses are deficient in one of the important amino acid which is provided from rice, okay, cereals. So that's how we are making up for it. इसको supplementary बोलते हैं. So I want you all to look at this chart. Can you see this? Everybody first look at this chart, guys. If you talk about cereals, okay, all right, so they are, what is limiting in it? CTL याद रखना, threonine and lysine. Pulses में most important is methionine, PM. ठीक है, methionine. And when you talk about maize, maize is also MTL. यहाँ पे instead of threonine it is tryptophan and lysine. Okay, so now tell me the correct answer for this. Now tell me the correct answer. और इस property को क्या बोलते हैं? Supplementary action of protein. We are eating dal and chawal together because whatever is limiting in dal is provided from chawal. Whatever essential amino acid is limiting in chawal is provided from dal. Okay, so now answer पे चलते हैं. What is it, guys? Wheat. Wheat में आप क्या रखोगे? Wheat is a cereal, right? So CTL, threonine and lysine. ठीक है? All right, everybody, methionine is limiting in pulses. Please don't forget it. This is an important question. जो भी मैंने 3 questions I've told you right now. Agar reference protein, supplementary action of protein. ठीक है? And one more which we discussed. They are all important for your exams. Essential fatty acid, linoleic. ठीक है? Okay, let's see one more question. Yes, this is also PYQ. Highest content of saturated fatty acid किसमें? Now we all know saturated fats are bad, right? So is it palm oil, butter, coconut oil, margarine? Now please remember, जैसे safflower oil is the best one because it has unsaturated acids. Now saturated coconut oil में बहुत ज़्यादा होता है, ठीक है? But more than that, what would you prefer? Okay, so I'll again show you a list over here. See, more than that, coconut oil and butter have almost the same value, ठीक है? So this slide is again important. You can mark coconut oil here, ठीक है? यहाँ से you can see safflower. PUFA means polyunsaturated fatty acids. Okay, so PUFA सबसे ज़्यादा safflower में है. This is also yielding linoleic acid. We just did it, right? Sunflower, soyabean, groundnut, palm. Remember, coconut oil is a bad oil. ठीक है? All right, and butter. So to get to the best answer here, you can go for coconut oil. Is it clear, everybody? See, these are basic things which you tend to ignore before your exams. Please don't do it. Exam में आता है. Safflower, why is it best? And what about coconut oil and butter? They contain maximum saturated fats. ठीक है? Now let us move forward. This is just an information yielding slide. We have already done it. Carbohydrates 4 kilocalories per gram, 50 to 70%. Fats 9, 10 to 30. This we have already done. I want you to look at the daily requirement of protein, guys. Please don't say it is 1 gram per kg body weight. Now it is 0.83 gram per kg body weight. और ये देख रहे हो, free sugar should be less than 10% of total energy. Now there is a diet. Listen to this carefully. There is a special diet which is known as prudent diet. Have you heard about prudent diet? Prudent diet saves us from cardiovascular diseases. Okay. Prudent diet protects us from cardiovascular diseases. In that diet, we say saturated fats should be less than 7 to 10%, and sugar should be less than 10%. And cholesterol HDL ratio कितना होना चाहिए, which is an MCQ? Cholesterol HDL ratio, okay, this should be less than 3.5. This is also an important question. ठीक है. Dash diet is for hypertension. Okay, somebody is asking dash diet. Dash diet होता है dietary approach to stop hypertension. अभी we'll see something when we talk about programs. We'll talk about dash diet, rule of halves, tracking phenomenon. ठीक है. Also look at this, guys. Fiber कितना energy देता है? 2 kilocalories per gram. Alcohol was how much? We just did it, 7 kilocalories per gram. Okay, and you all know fibers do what? They reduce chance of CAD, diverticulitis, irritable bowel syndrome. So all these are information yielding slide. Now this is a question of Jan 2023 Fmge question, a very basic question, and most of you ignore it. Batao, you don't study okay, when all right, okay, so I have people they have asked me to take MCQ PYQ for UPSC also. कब लूँ? अच्छा, anyways, which of the following is not a trace element? Not a trace element. Very good. Now you all know calcium, but let us just revise. So you'll just see a slide over here with me, guys. Okay, so look at this slide. देखो, सबसे पहले when you study nutrition, you have two things. All right, macronutrients. Let's revise it. Macronutrients, and we have what? Micronutrients. Okay, what are macronutrients? जो अभी हमने पढ़ा, proteins, fats, carbs. Okay, these are macronutrients. They are also known as what? They are also known as proximate principle of our diet. ठीक है, proximate principle. They are required in bulk. Okay, but micronutrients is vitamins and minerals. Now when you talk about minerals, okay, in minerals you have major minerals and trace elements. Okay, this is important. So when I talk about major minerals, it is calcium, phosphorus. Always we talk about calcium, phosphorus together, sodium, potassium, magnesium. But all these things जो important है, iron, iodine, fluorine and zinc, ये चार याद रखो. We study them separately also. Don't we study iron separately? Don't we study iodine separately? Right? Don't we study fluorine separately? You'll see the importance of fluorine. Don't we study zinc separately? Okay, they are all trace elements. ठीक है. So major minerals is calcium, phosphorus, sodium, potassium, magnesium. The trace elements हो गया तुम्हारा iron, iodine, fluorine as well as zinc. Got it? Everybody, is it clear? ठीक है. This is an important question. Please don't mess up. So यहाँ पे your answer becomes calcium. All right. Now let us first look at MCQ, then do the topic of food adulteration. June 2022. All can be used to treat kesari dal toxicity except food adulteration is a very important topic. We'll discuss it. First tell me the answer. Kesari dal toxicity. Now what is kesari dal, everybody? Then I'll go back to that slide. Kesari dal, you all know, is Lathyrus sativus. Okay, Lathyrus sativus. Now what toxin does it contain, guys? This contains the toxin BOA, beta oxalyl amino alanine. Okay, and this BOA, okay, is the toxin. Now this leads to what? Consumption consumption of 30% of the dal over 6 months will lead to what is known as neuroletharism. When you talk about neuroletharism, the person में क्या होता है? Spastic paralysis of lower limb, not flaccid paralysis. Just keep listening. Spastic paralysis of lower limb, not Argemone mexicana. हितेश, Argemone mexicana is different. That is epidemic dropsy. वो अभी देखेंगे, ठीक है? Spastic paralysis of lower limbs, and particularly this is seen in Andhra Pradesh, UP, all those places, ठीक है? Now, so to protect from this, the government banned the crop. You can remove toxin. Vitamin C also can be given for prevention. DEC is used for prevention and treatment of filariasis. Okay, DEC is used for prevention and treatment of filariasis. But even now, some cases do get reported. Why? Because remember, Khesari dal resembles arhar dal. Do you know arhar dal? Arhar dal. Okay, Khesari dal resembles arhar dal. Arhar dal is the sambar dal. Okay, arhar dal होता है जिससे सांबर बनता है. Okay, Khesari dal resembles arhar dal. Arhar dal is the sambar dal. So people are still growing this illegally and mixing it with arhar dal. ठीक है? All right. So this is about it. So you can see, you can have 1 6 stage, ठीक है, 2 stick stage. Okay, in this neuroletharism, 1 stick stage, 2 stick stage, crawling stage, all of this can be there. This is seen in UP, MP, Maharashtra, West Bengal, Chhattisgarh. Osteoletharism is not present in humans. Ban the crop, toxin removal, पार बॉइलिंग भी करते हैं. एंड विटामिन सी क्यों देते हैं? नेक्स्ट टाइम दे कैन आस्क यू व्हाई आर यू गिविंग विटामिन सी? टू डिक्रीज द इफेक्ट ऑफ बोआ. All right, so all questions came here. And in the MCQ, in case you find that a person hailing from West Bengal, Maharashtra develops spastic paralysis of lower limb, that directly gives you a hint that we are talking about neuroletharism. Okay, this is what? This is your Lathyrus sativus. Okay, this in case they give you. This is Khesari dal. All right, next. Now see, food adulteration. Every year they are giving you a question. What is the answer to this? A 40-year-old female with no comorbidity complains of swelling in both her legs. ठीक है, swelling in both her legs of acute in onset. She also gives a history of loose stools. Her family members too have similar symptoms in family members, but on examination there are no signs of inflammation. Okay, swelling है, edema है, but no signs of inflammation. That means there is non-inflammatory edema. Okay, there is non-inflammatory edema, and then the family members are also complaining of the same thing. That means they are eating something. Okay, maybe here it's written mustard oil, so it is sanguinary. So here we are talking about contamination of what? We are talking about contamination of mustard oil with what? With argemone oil. Contamination of mustard oil with what? With argemone oil. Okay, so contamination of mustard oil, everybody, with which oil? With argemone oil. And this is what is known as epidemic dropsy. Okay, now mustard का पौधा, सरसों का fields are completely yellow in color. Okay, and just close to them you will see the weeds of Argemone mexicana growing. ठीक है, so that is important. And here argemone oil में कौन सा toxin होता है? Sanguinarine. The important thing is, guys, look, it leads to non-inflammatory edema, not inflammatory edema. Okay, which type of edema? Non-inflammatory edema. Okay, so there is bilateral non-inflammatory pitting edema, diarrhea, dyspnea, cardiac defects, glaucoma, which can lead to death. Now management has also been asked. Remove the weeds from the field. ये पूछते हैं नाइट्रिक एसिड क्रोमेटोग्राफी टेस्ट is to check for which adulteration. Okay, they can give you in the options boa, sanguinarine, pyrrolizidine. किसके लिए होता है? Okay, so remember nitric acid chromatography test is to check for, this is important, argemone adulteration. Okay, nitric acid chromatography test is to check for argemone adulteration. Got it? Everybody clear? Will you remember this small thing for your exams, guys? Okay, let us move to the next one. This came in our INICET exams. This is Argemone mexicana flower. Okay, this is Argemone mexicana flower, which is yielding what? Argemone oil. Okay. All right, moving to the next one. What is this? So last thing that you have, crotolaria या झुनझुनिया seeds. Okay, this is what? Crotolaria seeds और झुनझुनिया seeds. Okay, झुनझुनिया seeds. इनमें कौन सा टॉक्सिन होता है? They have the toxin what? They contain the toxin pyrrolizidine. Okay, pyrrolizidine, which is leading to what? Endemic ascites. Okay, this leads to what? Endemic ascites, guys. Okay, this leads to what? Endemic ascites. So finally the gist of this, okay, working in a groundnut industry puts you at risk of what? So please remember, जो groundnut होते हैं ना, उसको कौन, who infests them? So that is a storage fungus. Okay, this also has come as a PYQ. What is the name of that storage fungus? It is Aspergillus flavus. Okay, Aspergillus flavus. This releases the toxin which is known as aflatoxin. Okay, and this aflatoxin can lead to HCC, hepatocellular carcinoma. ठीक है. There is also something known as ergotism, right? So ergotism क्यों होता है? Now it is because जो of the field fungus Claviceps fusiformis. ठीक है. Ergotism is due to the field fungus. फील्ड फंगस का क्या नाम है? क्लैविसेप्स फ्यूजिफॉर्मिस. क्लैविसेप्स फ्यूजिफॉर्मिस. सो हैविंग डन दिस, जस्ट कम टू दिस स्लाइड वंस, जो बिगनिंग में था. यू जस्ट हैव टू गो थ्रू दिस स्लाइड गाइज, विच हैज कम इन, विच इज अ लॉट ऑफ थिंग. खेसरी दाल, बोआ, मस्टर्ड ऑयल, सैंग्विनरीन, आर्जिमोन ऑयल, मिलेट्स के अराउंड दीज वीड्स ग्रो. ओके, क्रोटोलेरिया झुनझुनिया सीड्स विच हैव पायरोलिजिडीन. ग्राउंडनट, सीरियल एंड मेज को खा सकता है, एस्परजिलस फ्लेवर्स. सोरघम, राई एंड बाजरा कैन बी इन्फेस्टेड बाय विच फंगस? Claviceps fusiformis. Okay, Claviceps. So they can give you sorghum के fields में, बाजरा के fields में. What is going to happen? So that is Claviceps fusiformis. Okay, so this is like a summary slide which definitely food adulteration will turn up in our exams. Chalo, let's move to the next thing. Yes, now some vitamins. What is the answer to this? An underweight adolescent girl is found to have the following finding on her ocular examination. What is the WHO grade of the finding? What is it, guys? Now actually this is not Bitot spot, guys. ये conjunctival xerosis है. Okay, this photograph is of conjunctival xerosis. So conjunctival xerosis is 1A. ठीक है. बिटॉट स्पॉट में यू विल सी अ ट्राइंगल काइंड ऑफ थिंग. ओके, ऑन बिटॉट स्पॉट इज ऑन द टेम्पोरल साइड ऑफ बल्बर कंजंक्टिवा. ठीक है. सो जस्ट बेस्ड ऑन दिस वी ऑल नो व्हाट इज xerophthalmia. Xerophthalmia occurs due to vitamin A deficiency. Vitamin A is very important topic, so it is due to vitamin A deficiency. These are the primary signs: X1A, X1B. X2 corneal xerosis, X3A corneal ulceration, less than 1/3 of cornea involved. And what is X3B? Keratomalacia, which is more than 1/3 of cornea. Plus we have secondary signs like night blindness, fundal changes, as well as we have corneal scarring. everybody. ठीक है. xerosis में dry eye लगेगा. Okay, you will not see the triangular foamy patch. Okay, if it is bitot spot you will see a triangular foamy patch. All right, but in your xerosis you will not see. Me go and do your spellings. In xerosis you will not bring it here and do. In xerosis you will not see a foamy patch. Okay, is that clear, everybody? Okay, now up to which stage is it reversible? Up to which stage? Up to which stage is the condition reversible guys? Up to x3a. ठीक है, x3a तक this is reversible. Okay, x3b is not at all a reversible condition. Okay, up to x3a everybody the condition is reversible. But if I ask you vitamin A का most common presentation is what guys? Please remember, most common presentation. Okay, most common presentation. Or if I ask you most common manifestation, ठीक है, most common presentation manifestation is night blindness. But most specific guys, सबसे specific क्या है? The most specific is bite or spot. Okay, then this question definitely turns up on the prevention and treatment. So prevention we have studied in the chapter of vaccine. At 9 completed months, give 1 ml or 1 lakh international unit of vitamin A every 6 months. Give 2 ml or 2 lakh international unit. That we have already studied in the chapter of vaccines. Now I am asking you the treatment dose. An 8-month-old baby on examination shows signs of vitamin A deficiency. What is the dose of vitamin A to be administered to the baby? Now the first thing, even if it is with 1 lakh सब लिख रहे हैं बेटा, 1 lakh दो जगह दिया हुआ है, C and D both में है. So what is your answer? Please remember, for treatment of vitamin A deficiency, okay, when you have to treat vitamin A deficiency. Okay, so for treatment of, we will prefer first oral doses. Okay, and it is given on day 0. 2 consecutive dose पहले देना है. On day 0 and day 1 we are going to give 2 consecutive doses on day 0 as well as day 1. Okay, and यहाँ पे what are we going to do? Up to 6 months. All right, up to 6 months. Then we are going to give 6 months to 1 year. Okay, and then it is more than 1 year. ठीक है, up to 6 months, 6 months to 1 year and more than 1 year. So here कितना होगा? 50,000, 50,000 and 50,000. All right, and 1 year में हो जाएगा 1 lakh, 1 lakh, 1 lakh. More than 1 year में 2 lakh, 2 lakh, 2 lakh. So ideally हम क्या दे रहे हैं? 2 consecutive dose. The actual answer you know is 2 consecutive doses. Okay, on 2 days. If it doesn't get treated, we repeat a dose on day 14. So this is 1 lakh international unit orally. Is it clear everybody? If you have to give IM dose, okay, if you have to give IM dose, remember IM dose is half of oral dose. ठीक है, IM dose क्या होता है? IM dose is half of oral dose. IM dose is half of oral dose. Yes, I can repeat it. See, whenever you talk about vitamin A deficiency treatment, ठीक है, we have to give it on 3 days. Day 0, day 1, 14. पहले हमें 2 consecutive days देना है, day 0 and day 1. And you have to divide the child into less than 6 months, 6 months to 1 year, more than 1 year. And this is how you will give 50,000, 1 year, 1 lakh and 2 lakh. ठीक है? And we are preferring to give oral doses. All right, prevention you've already studied. Some golden points. Which is the richest source of vitamin A guys? Richest source बताओ vitamin A का? So the richest source is halibut fish. Halibut fish is the richest source of vitamin A. It is also the richest source of vitamin D. Okay, it is also the richest source of vitamin D. Then do we consider vitamin A as a public health problem? Yes. Please remember these two are PYQ which I am showing it. If you do a survey among children 6 months to 6 years, okay, if we do survey among children 6 months to 6 years, and if we find the prevalence of night blindness more than 1% and bite or spot more than 0.5% in the community, it is a public health problem. ठीक है, cod liver is the second. Very good. Richest source of vitamin A as well as vitamin D is halibut fish. Okay, and whether it is a public health problem or not, so for that we have to do a survey among children 6 months to 6 years, and if you see the prevalence of bite or spot as more than 0.5% in community and night blindness more than 1%, you will say it is a public health problem. Second PYQ which comes, white polished rice eaters are at risk of which disease everybody? कौन सी विटामिन डेफिशिएंसी होती है? वाइट पॉलिश्ड राइस ईटर्स में, एवरीबडी, वाइट पॉलिश्ड राइस ईटर्स में व्हाट इज द विटामिन डेफिशिएंसी इन वाइट पॉलिश्ड राइस ईटर्स? एवरीबडी, वेरी गुड. सो इट इज B1 deficiency, which is thiamine deficiency. Okay, so that is B1. All right, thiamine deficiency. This leads to what? Beriberi. Cardiovascular beriberi, CVS berry affecting cardiovascular system is more serious. This is also seen in chronic alcoholics. Okay, chronic alcoholics go on to develop thiamine deficiency और इसको क्या बोलते हैं? Wernicke's Korsakoff psychosis. Wernicke's Korsakoff psychosis. Okay, Wernicke's Korsakoff psychosis. Any of this can come in your exams. Very good. All right, so CVS is what? Wet beriberi. Very good. ठीक है. Okay, next one, vitamin B3 is riboflavin. Okay, so B2 is riboflavin. So when you talk about B2 deficiency, these things happen. This we all know is kilosis. Okay, this is angular stomatitis. Okay, angular stomatitis, and there is one more manifestation, which is what? Geographical tongue. Okay, geographical tongue. Geographical tongue को हम लोग और क्या बोलते हैं guys? Glossitis. ठीक है, geographical tongue is glossitis. So magenta red tongue is B2 deficiency. Beefy tongue is B12 deficiency. Strawberry is seen in scarlet fever. All right, one more question that is nowadays very common from B12. everybody, B12 में एक बहुत common question आता है. B12 deficiency is predominantly seen among vegetarians. Okay, B12 deficiency किस में देखने को मिलती है? Do we see it among non-vegetarians? No. B12 deficiency is seen among vegetarians. Plus Fmge के PYQ में there also came a question. B12 की deficiency leads to what? SACD, subacute combined degeneration of spinal cord. Okay, so these are some important things that definitely can turn up in your exams. All right, now look at this most important question. There's a rash, there's a complaint of diarrhea, dementia. On questioning, it was reported maize is the diet. What is the diagnosis over here? Maize report हुआ था diet. Very good. So this we all know is niacin. Now another question that comes is, why in maize eaters do you have niacin deficiency? Okay, why do you have niacin deficiency in maize eaters? So we all know that there is something known as tryptophan. Tryptophan gets converted into niacin. Okay, in maize eaters, is there deficiency of tryptophan? No. Among the maize eaters, there's excess of what? Excess of leucin, and this leucin prevents conversion of what? This leucin क्या करता है? This leucin prevents the conversion of tryptophan into niacin. ठीक है, excess of leucin की वजह से. Another question, 60 milligram tryptophan. Okay, 60 milligram tryptophan is going to give us 1 milligram niacin. All right, and deficiency of niacin is leading to what? Pellagra. Here you can also see castle's necklace appearance. ठीक है, अब देखो, these are some golden points, that excess of leucin, 60 milligram tryptophan, 1 gram of niacin. Look at the other way in which comes. ठीक है, skin changes में photo miss हो गया. It is something like this only, castle's necklace. What? Okay, so whenever you talk about niacin deficiency, you have to take the history of diarrhea, dementia, because it presents with what? Diarrhea, dementia, dermatitis. Okay, dermatitis, then delirium. All right, delirium. Also it presents with depression, death. Okay, 6 Ds. कितने Ds लेके आता है? 6 Ds लेके आता है. All right, this is a $1 million question, keeps coming in your exams. So now next question, look at this. A 45-year-old man living in Nellore, Andhra Pradesh, presents with the following lesion. What is this? So remember, look at the teeth. This is mottling. Okay, mottling of upper incisors. ठीक है, mottling of upper incisors. Now this is seen in what? Fluorosis. ठीक है, this is seen in what? Fluorosis. So now what is the normal fluoride content in water? वाटर, नॉर्मल फ्लोरीन कंटेंट पानी में कितना है? नॉर्मल फ्लोरीन कंटेंट इन ड्रिंकिंग वाटर एवरीबडी शुड बी हाउ मच? इट इज 0.5 to 0.8 milligram per liter, right? Normal normal fluorine content in drinking water should be 0.5 to 0.8 milligram per liter. Now dental fluorosis, when does it occur? If anybody asks you, please don't say more than 0.8, no, more than 1.5 milligram per liter, okay? Dental fluorosis occur करता है. There is another fluorosis which is known as skeletal fluorosis. When does that occur? Skeletal fluorosis 3 to 6 milligram per liter. ओके, दैट इज व्हेन स्केलेटल फ्लोरोसिस अकर. एंड एक और होता है तुम्हारा क्रिपलिंग फ्लोरोसिस. क्रिपलिंग फ्लोरोसिस इज सीन व्हेन इट इज मोर देन 10 मिलीग्राम पर लीटर. ठीक है, all this is important. And how does crippling fluorosis present as? देखो, this is crippling fluorosis. Can you see? This is crippling fluorosis. In crippling fluorosis, the legs are sticking. Okay, what is this known as? Knock knee. Knock knee. The knees have come together and they have stuck by gum. तो इसको क्या बोलते हैं? जेनु वैल गम. ठीक है, ऐसा लग रहा है that they have stuck together by what? They have stuck together by gum. So this is known as genu val gum. Okay, this is what? Crippling fluorosis. This of course is dental fluorosis. Please don't write scurvy. In scurvy there is vitamin C deficiency, there is swelling of the gums. So whenever you get a picture, look at whether they are showing you swelling of the gums or something is wrong with the teeth. Okay, all right, यहाँ पे हो गया dental caries. Okay, then one question comes, dental caries is less than, fluorine is less than 0.5 milligram per liter. One question that comes is, how will you remove excess of fluorine from water? So it is Nalgonda technique. This is a PYQ. Yes, vitamin C deficiency leads to collagen defect. Very good, collagen defect. Okay, impaired healing and all that, कोलाजन डिफेक्ट. इवन जिंक की डेफिशिएंसी में कोलाजन डिफेक्ट होता है. ठीक है, ऑल राइट. सो नालगोंडा टेक्निक इज टू रिमूव एक्सेस फ्लोरीन फ्रॉम वाटर. रिमूव एक्सेस फ्लोरीन. दिस वॉज डेवलप्ड बाय नीरी इंस्टीट्यूट, नागपुर. ओके, नेशनल एनवायरमेंट इंजीनियरिंग इंस्टीट्यूट. आई एम जस्ट रिवाइजिंग विद यू सम पॉइंट्स गाइज. एंड हाउ डू यू ब्रिंग इट? बाय एडिंग 3 थिंग्स. लैब. ठीक है, वन इज लाइम, द अदर वन इज alum. Okay, and the other one is bleaching powder. It's the same order in which it is added. Okay, the first you will be adding lime, फिर alum, फिर bleaching powder. Got it? Okay, now last thing, let's see some of the national health programs referring to nutrition. ICDS क्या है? Integrated Child Development Services Scheme. Anybody knows ICDS is a very important nutrition related program, right? And pregnant women, lactating women, adolescent females, okay, children 0 to 6 years all get enrolled under this. So what is the additional calorie which is being given to a pregnant female under ICDS? It's not like nahi 350 मत बोलो. 350 is according to NIN which you just saw. Okay, that is different. Very good. It is 600 kilocalories. So let us talk about this. This is integrated. What are the question that comes from here? This is integrated child development. Okay, child development services scheme. Okay, services scheme. S stands for services. Okay, a question that comes is ICDS is under which program? So please remember this is under Ministry of Women and Child Development. Okay, and it is under so many beneficiaries. 0 to 6 years pregnant lactating mothers, we are providing supplementary nutrition. नॉन फॉर्मल एजुकेशन, प्री स्कूल एजुकेशन के लिए दूसरा वर्ड क्या है? नॉन फॉर्मल एजुकेशन. ओके, हियर प्लीज रिमेंबर वन थिंग, इन सर्टन states also adolescent girls are part of this scheme. So under this additional कितने calories मिलते हैं? Forget about pre-revised. Okay, if it is 6 to 72 months, all right, ठीक है, up to 6 years 500 kilocalorie and 12 to 15 gram. But if it is a SAM child तो थोड़ा सा बढ़ा दो, 820 to 25. Pregnant women 618 to 20. Please don't say 350. 350 is according to National Institute of Nutrition. Okay. All right, next this is the latest update and a very important program which is प्रधानमंत्री. पीएम से क्या होता है? प्रधानमंत्री. ओके, दिस इज व्हाट प्रधानमंत्री पोषण शक्ति निर्माण. इसको दो में बांटो. वन इज पोषण अभियान. ओके, वन इज पोषण अभियान एंड द अदर वन इज पीएम पोषण. प्रधानमंत्री पोषण. इनिशियली पीएम पोषण वो पहले क्या था? मिड डे मील था. इनिशियली पीएम पोषण वॉज मिड डे मील. ओके, इनिशियली ये क्या था? मिड डे मील था. ऑल राइट, दिस वॉज इनिशियली मिड डे मील. नाउ लेट्स टॉक अबाउट बोथ ऑफ दिस. पोषण अभियान is also under Ministry of Women and Child Development. Midday meal, which is now PM Poshan, is under Ministry of Education. Okay, any of this can come. So let us see the logo of Poshan Abhiyan. This is Poshan Abhiyan. Okay, Pradhan Mantri's overarching scheme for holistic nourishment, not nutrition, nourishment. Just look at this logo and remember it is under Ministry of Women and Child Development, just like ICDS. ठीक है, ये आता है. In this, we are trying to, it was launched in 2018, we are trying to reduce prevalence of underweight, we are trying to reduce anemia, stunting. Okay, so look over here, this is also known as National Nutrition Mission. We are trying to reduce stunting. Okay, we are trying to reduce underweight, anemia and low birth weight. ठीक है, I hope all of you know what is stunting, guys. I mean, what is stunting? So this is a very important question. Low weight for height. Low weight for height is acute malnutrition. Okay, low weight for height, everybody, is what? Acute malnutrition. Acute. ठीक है, low weight for height. This is also known as wasting या emaciation. Okay, emaciation. Then low height for age. ठीक है, लो हाइट फॉर एज इज क्रॉनिक malnutrition. दिस इज ऑल्सो नोन एज व्हाट? स्टंटिंग. ठीक है, एंड लो वेट फॉर एज. लो वेट फॉर एज, everybody, if according to up to 5 years, if a child is low weight according to his age, this is underweight. Okay, and this is an indicator not of acute, it is acute on chronic malnutrition. Remember this. Most of you have a tendency to say that मोस्ट ऑफ यू क्या बोलते हैं कि अक्यूट malnutrition इज लो वेट फॉर एज. नो, रिमेंबर, अक्यूट इज लो वेट फॉर हाइट. ओके, अंडर वेट इज अक्यूट ऑन क्रॉनिक. ठीक है, ऑल राइट. नाउ दिस इज मिड डे मील. ऑल द चिल्ड्रन आर सिटिंग ईटिंग फ्रॉम अ कॉमन प्लेट, बट दिस इज नाउ व्हाट? नाउ इसका नाम है प्रधानमंत्री. एक्चुअली द फुल नेम इज प्रधानमंत्री पोषण शक्ति. ओके, दिस स्कीम वॉज लॉन्च टू प्रिवेंट dropouts. Okay, to prevent dropouts from school. ठीक है, to prevent dropouts. Parents would send their children thinking they would at least eat in the school. Okay, now why have we changed the name? Because initially we are including class 1 to 8 children. अब इसमें हमने बाल वाटिकास भी इंक्लूड किया है. बाल वाटिकास मतलब प्री स्कूल चिल्ड्रन. ऑल राइट, plus we have included children from class 1 to 8, mostly up to अपर प्राइमरी एंड प्राइमरी स्कूल. ठीक है, क्लास 1 to 8 को हमने इंक्लूड कर लिया. बट नाउ मोस्ट इंपॉर्टेंट इज वी हैव इंक्लूडेड बाल वाटिकास. एंड हाउ मच एनर्जी एंड प्रोटीन वी आर गेटिंग फ्रॉम मिड डे मील? 1/3 calorie plus half of protein. The menu is always fixed, guys. It is made in such a way that it will fulfill all your nutritional requirements. Last but not the least, Shobi, which exam are you talking about? नीट पी जो भी नीट, कि अभी FMG तो अभी नेट बोर्ड ही कराएगा ना. अभी 30 जून को, 30 जुलाई को तो नेट बोर्ड ही हो रहा है, right? So at least first do all your FMG PYQs, get done with them, go for NEET. Then if you have time, then okay, PSM के लिए try to do both FMG as well as NEET PG last 2 years के PYQ at least. On Prep Ladder app I have taken, okay, please remember, on Prep Ladder app I have taken last 5 years का PYQs. ठीक है, you can refer to that. Okay, I will put out the link also in the section, last 5 years most important PYQ, not app, sorry, on Prep Ladder YouTube channel. Okay, I have taken it, so you can have go through that also. Abhi just focused on ye wala, theek hai? All right, anemia mukt Bharat, what is it? Under this we are providing prophylactic iron folic acid. So can you tell me beneficiary कौन है? 6 months to, ठीक है, 6 months to 5 years, 59 months, 5 to 9 years, 10 to 19 years, adolescent, yes, the flashback series, 10 to 19 years adolescent, ठीक है. Then you have here 10 to 19 years में you have both boys and girls, okay. And then what do you have? You have reproductive age females and ठीक है 20 to 49 years, non pregnant, non lactating, and last but not the least you have pregnant and lactating females, okay, pregnant and lactating. अब इसको तुमने क्या क्या देना है? What are we giving over here? We are giving prophylactic iron, we are also giving prophylactic folic acid, and there is a schedule to be followed, okay. So when I talk 6 months to 59 months, 20 milligram elemental iron, and we are giving 100 microgram folic acid to be given bi-weekly. और क्योंकि ये छोटे बच्चे हैं, we are giving in the form of a syrup. 5 to 9 years, 4 and 4, 45 milligram, 400 microgram folic acid. This is again to be given weekly, okay. But rest सब जगह लिख दो 60, 60, 60, 500 microgram, 500 microgram, 500. But please remember 10 to 19 years are adolescents, so we are giving them blue color tabs. Iron की नीली गोली, so you can get a question, iron की नीली गोली is for adolescents, okay. Iron की नीली गोली, everybody is for whom? For adolescents. And this is also being given weekly. Non-pregnant, non-lactating, again we are giving weekly, but pregnant and lactating women, we start after the end of first trimester, and we can give up to 6 months post lactation, so that is given daily. Remember the doses, okay. So you can see over here prophylactic iron folic acid we are giving. Deworming, yes, deworming is also being done under anemia mukt Bharat. Pregnant female की deworming कब होती है? Pregnant women deworming is done around the deworming is done around the 7th month with a full tablet of albendazole, okay. Full tab albendazole देते हैं हम लोग, okay, for the pregnant woman. However, if the child is less than 2 years, half tab albendazole. More than 2 years, okay, अगर child less than 2 years है, less than 2 years है, we are giving half tab albendazole, okay. And if the child is more than 2 years, guys, we are giving a full tab of albendazole, all right. Plus we are also providing iron folic acid rich foods, ठीक है. Okay, just a few more things that I want you to do. Can you all identify? अच्छा, ये slide में एक बार देख लो. This is a PYQ based question. It came. Which is the most useful index, okay, to evaluate iron status? Which is the most useful index to evaluate iron status? Remember, it is serum iron concentration. ठीक है, ये आया है exam में. And which is the most sensitive tool? Serum ferritin. This is directly from our textbook of PARC. I just want to when you talk about evaluation of iron status, it is serum iron concentration, and most sensitive tool के लिए ferritin है, ठीक है. Value देख सकते हो, but ठीक है. Now last but not the least, look at this. Which logo is this? Which logo is this, guys? कौन सा लोगो है everybody? Which logo is this? So we all know this is A, not ISI. ISI नहीं है. Bureau of Indian Standards. It's not ISI. Bureau of Indian Standard ensures quality above minimum. ठीक है, ensures quality above minimum. देखो, if you go to buy jewelry, all right, you will see there is a mark in it, BIS mark. If I need minimum quality of food products, okay, minimum quality of food products. So minimum quality of food products, everybody, is given by whom? Minimum quality of food products is given by Prevention of Food Adulteration Act. But above minimum quality, okay, above minimum अगर मुझे चाहिए, we get a BIS mark done. ठीक है. All right, ISI is also a branch of that only. So now national food standards is adopted from FSSAI. FSSAI has given us the national food standards, okay. And where is the headquarter of national food FSSAI headquarter is in New Delhi. And from where did we get these national food standards? From Codex Alimentarius, which have given us the international food standards. WHO का हेडक्वार्टर है जिनीवा में, फाओ का हेडक्वार्टर है रोम में, ठीक है. All right, I think we are done. This is the logo for Agmark, agricultural products, okay. One more question I wanted to show you. Can you tell me Phrynoderma? Phrynoderma is deficiency of, this is a PYQ. Phrynoderma किसकी वजह से होता है? Phrynoderma, is it zinc, selenium, iodine or essential fatty acid? Phrynoderma is due to deficiency of anybody. Phrynoderma is due to deficiency of what? Not zinc, not zinc. It is essential fatty acids. So many of you don't know. This is Phrynoderma. Okay, in Phrynoderma, it is stored like skin. ठीक है? All right, that is Phrynoderma. All right, that is very, very important, which can come in your exam. So that's it, everybody. In this slide, I've just written some sources. You can see essential fatty acids, safflower oil, vitamin A का richest source. These are all richest sources, okay. Richest source halibut liver oil, vitamin D का भी, आंवला का रिचेस्ट, विटामिन सी का रिचेस्ट सोर्स आंवला. गोल्डन राइस में क्या क्या होता है? विटामिन ए, आयरन. दिस इज एन एग्जाम्पल ऑफ फूड फोर्टिफिकेशन, ठीक है. विटामिन B12 नो प्लांट सोर्स. सैचुरेटेड फैटी एसिड सबसे ज़्यादा कोकोनट ऑयल में है. मोनो अनसैचुरेटेड ऑलिव ऑयल में है. सैफलार ऑयल में वी हैव पॉली अनसैचुरेटेड, ऑलिव ऑयल में मोनो, ठीक है. Yes, selenium deficiency is Kishan's disease. Very good. Amla is Indian gooseberries. Very good. All right, everybody. So I think that's it for today. And there's one more slide where you have some golden points. Yes, milk is a poor source of vitamin C and iron. ठीक है. Meat is a poor source of calcium. Egg is also a poor source of vitamin C and carbohydrates. Rest we have already done. Which is a very good weaning food? Ragi. Ragi में calcium होता है. आयरन का रिचेस्ट सोर्स इज ड्राइड पम्पकिन सीड्स गाइज. आयरन का रिचेस्ट सोर्स, ठीक है, ड्राइड पम्पकिन सीड्स है आयरन का रिचेस्ट सोर्स, ठीक है. Thymine का richest source is gingerly. All these are PYQs from different exams which I am showing you. So you can go through this. Of course, remember milk विटामिन सी आयरन नहीं होता है. एग विटामिन सी कार्बोहाइड्रेट्स नहीं होता है. ब्रेस्ट मिल्क में मोस्ट एफिशिएंट इफ यू हैव टू मार्क गो फॉर विटामिन डी मोर देन विटामिन के. ऑल राइट, ओके, ठीक है, क्योंकि विटामिन के हम लोग इंजेक्ट कर देते हैं एट द टाइम ऑफ बर्थ इन चिल्ड्रन, ठीक है. बट विटामिन डी इफ आइडियली होता है, बट इफ यू हैव टू मार्क वन, गो फॉर विटामिन डी. ऑल राइट, so that's it for today. Thank you so much, everybody. We have not been able to take a few classes, like 1 or 2 day it was missed, so वो एक एक दिन आगे बढ़ते जाएगा, ठीक है. Go through the roster that way is only, like tomorrow I think in the roster it will be diseases. It was supposed to be taken today, but diseases कल होगा. Some important diseases, guys, we will discuss it tomorrow. All right, and today 10:30 p.m. okay, 10:30 p.m. we are going to have Telegram quiz, everybody. All right, it will be on nutrition only, or we can have kind of a mixed bag today, or let's have a nutrition mixed bag we will have towards the end, ठीक है. And keep following the roster. Please remember 6th को no class. On 6th of July we will have no class, okay. All right, so we'll just keep extend it by 1 day, ठीक है. All right, thank you so much. Have a good day. Bye bye. Take care. Any
Bye
question,
bye.
any query, you can message to me on a Telegram group or Instagram, wherever you feel comfortable, okay. Yeah, hi. Okay, bye bye. Thank you.
Bye bye.
Bye bye.
How many children do you also do?
Hmm?
How many children are